Hello, good evening. Dr. Chidi Ufondu of Snowspirations Global Health Solutions. This evening, we are talking about genotype and preventing sickle cell disease. Genotype and preventing sickle cell disease. So, we're going to understand what genotype is all about, and we're going to look critically at different ways we can achieve preventing sickle cell disease in the family. And I'm going to start. Please, when you join, just tell me if you can hear me, if you can see me clearly. Then after my presentation, I'm going to take questions and I'll attend to all questions. Now, your genotype, it's a unique component that makes you who you are. Every individual has that genetic component, genetic unique components that makes you who you are. Now, how did you arrive at your genotype? Your two parents. So whatever your parents have before conceiving you will by default be what your genotype will be. Your genotype plays a lot of role in disease development, in abnormalities, in a couple of things, especially sickle cell disease. Now, there is a substance that carry blood, that carry oxygen inside the red blood cells. It's called hemoglobin. So the marker for genotype is actually located in this hemoglobin. Now, everybody is expected to have two alphabets, which connotes your genotype. So your genotype can either be AA, AS, SS, SC, AC, and a couple of other relatively unknown genotypes. Now, it's important for the family to be conversant with the genotype of the parents and the siblings and the kids for the singular purpose of reducing the burden of sickle cell disease. So I wanted to focus on sickle cell trait and sickle cell anemia. I'm going to explain. Now, let's do a couple of assumptions. So, assuming your two parents have a genotype of AA, your mom is AA, your dad is AA, when both of them come together, they can only have AA genotype kids. Now, on the other hand, if your father is AA and your mother is AS, for every conception, you will have a probability of having a 25% chance of having a unique genotype. So the leveler in our society, in our community, regarding reducing the burden of sickle cell anemia, it's the AA genotype. So once you don't have AA genotype, the other type of genotype you have is a carrier of abnormal genotype, abnormal hemoglobin. So I want you to focus on S and C. And I'm going to use myself as an example and my family. Before I came to America, I've always thought I'm AS. So how did I arrive at AS? Two opportunities. My father or my mom, one is AA, the other one is AS. That's how you arrive at AS. That's how you can only have an S. Someone in the family must have that abnormal, gene. Now, it's a trait. It doesn't mean you have sickle cell anemia. It means you are a carrier. But lo and behold, when I came to America and I had a need to give my daughter blood, they discovered that I'm not actually AS, than AC. So there is a rare genotype we call AC. It's not air conditioner. So it was when I had a need to give my daughter blood that they ran my blood and discovered that the AS I actually thought I had is actually AC. So it's important for my community to make it a point of duty, especially if you have not started your family. It's important you genuinely, reliably know your genotype, because your genotype will determine the genes of your kids. So apparently, either my dad or my mom had a C abnormal genotype. And I got A either from my mom or from my dad to become a C. Now, the fact I knew prior to marriage that I'm not AA, I have to be meticulous in choosing my partner. We have to have that conversation very early. So this is where I will caution so many people in relationships. I understand love. Love is a beautiful thing, but we are talking about our generation now and next. Sickle cell anemia, sickle cell disease is a very debilitating disease that over time, those kids are going to have a lot of challenges. Then eventually, some of them might not live up to their life expectancy. But we can completely, 100% prevent sickle cell anemia, sickle cell disease in our community. How can we do this? Awareness. So if you have not had that conversation in your relationship, I want you to start a conversation. I want you to go and check and make sure that your genotype is correct. Now, if you can tell me your genotype when you join, I will help you to understand it better. Like I gave you guys my own example. I'm AC. My wife is AA. So what happened in my two kids? Both of them are AC. How did Zara arrive at AC? Because my wife possibly contributed her A and I gave her the C. The same thing is applicable to the major. My siblings are practically all AC. So it's what your parents will give you that you will have. Now, how can we prevent sickle cell disease? How can we prevent it in our community? Awareness. So if you know ahead of time that you are AS, it's okay to have boy-girl friend, but when you're talking about stepping it up to the next level of relationship, please seek out an AA. I'm not saying this with any sense of stigmatizing people that have sickle cell. People that have sickle cell disease can still find love. But it won't make sense to be a sickle cell person. You've had a lot of trauma. You've had a lot of life challenges. Then you fall in love with someone who is SS, only to have kids that will still go through the same fate. No, we always want the best for our kids. So know your status before you consolidate on your relationship. This is the singular most effective way of preventing sickle cell disease. Now, the problem in sickle cell disease is the fact that they have a lot of blood issues that will lead to clogging and poor transfer of oxygen around the body of the person that has this. And over time, they will have what we call vaso-occlusive crisis, which will present as excruciating pain. And all the organs in the body for someone that has sickle cell disease will be affected. So they will not have their potential quality of life exactly how God planned it. And it's completely preventable. Now, if you have already contracted your relationship, if you are already married and you are AS and your partner is AS, please, you can still go for genetic counseling. You can still meticulously go for assisted reproductive technique so that we can carefully make sure that the babies you're going to have will not have sickle cell anemia. But if your relationship today, it's compatible. So I'm going to use compatibility, okay? Now remember, whatever I'm telling you is purely educational and advice. At the end of the day, you're an adult. You can use it to make your own decisions, but I'm talking about quality of life. So if you're joining, please, can you tell me your genotype once you join? If your genotype is AA, you don't have problems at all. You can marry anybody. You can have relationship with anybody. It doesn't matter. You guys are the people that will help save the world and eradicate the world from sickle cell disease. So the people that can actually help us to completely eradicate people that have AA. We need you to step up. Now, it's fallacious to tell me there is only one person that can love you in life. It's not true. There are so many people that can love you the right way out there. So please, everybody that joins, I need you to tell me your genotype, okay? Once you join, tell me your genotype, then I will tell you what you need to do. If you've already contracted your relationship, then I can also give you one-on-one advice on what you need to do. Our aim is to help in preventing our kids or our kids from having this. Now, when it comes to relationship, it can be very messy. It can be complicated. So remember, AA, you are good to go, okay? Anybody, it's okay. AS, please, and please, before you consolidate your relationship, before you go into deep in that conversation, ask your partner genuinely, and both of you should go and seek a reliable lab and make sure that your partner is AA. So Tosin, you are AC. Are you currently already in a relationship, or are you single? Have you started having your babies? So practically everybody in attendance today, Jane, your AC, Mara, Kafu, your AA. So Mara, you are the people we are looking forward to. We want you to go out there in the community and dilute the effect. So Tosin, your partner is AA. Good job. This is what we advocate for. This is what we want. Because guess what's going to happen in Tosin's case? By the time, if you already have kids, by default, all things being equal, you're going to have kids that will be AA. You're going to have some kids that will be AC. That's the combination of kids you're going to have. Because what you have is A and C. So you have combination. So every childbirth, you have a 25% chance of having a child that will have AA genotype. And you also have a 25% chance of having a child that will have AC genotype. So you can only have AC and AA in your family. Why? Because you have the presence of the abnormal genotype in your own combo. But your partner is AA, so perfectly okay. Now, Jane, you are also AC, but your hobby is AA. So both of you are exactly where we want it to be. So completely 100% okay. Now, Tosi, correct. Your daughter is AA and your son is AC. By default, you can't go wrong with this. These are evidence-based. Now, remember AA, good to go. AS, look for AA. AC, the same thing. AS and AC are brothers and sisters. They are also the things you need to be on the lookout for. So avoid C and avoid S. They are the same thing. So if you are AC, seek out an AA partner. Carefully, diplomatically. You can still love someone and you want that person to be around in next 20, 40, 60 years. You don't want to love someone, then the person will suffer and die. That's no longer love. So both of you are in a good place. Okay? Now remember, I've mentioned AA, I've mentioned AC, I've mentioned AS. Just be careful, okay? Now, you can also have a combination of S and C. So SC, it's also a combination. You need to be meticulously careful because you have two abnormal genotypes, S and C. So your partner should be by default who? AA. Now, if you have double S, it means you have combined what we call homozygous sickle cell anemia. So you have two abnormal genes. That's the sickle cell disease itself. So there is nothing wrong in coming into this world and your parents brought you into this world and you notice your your SS. It's okay. You can forgive your parents, right? Because anybody that is in this world should thank God. The other alternative is not to be born. So if you come into this world and you notice you've been battling sickle cell crisis and all that, then you can still find quality of life. There are so many women that are SS. There are so many men that are SS that can still live far into, if not better, than people that might not have it. It's all about being aware. But please don't show up in my community and your SS. You've been battling a lot of sickle cell crisis since your adult age. Now you're in your 20s. You're tending towards your 30s. You have a whole lot of your future in front of you. You even have a possibility of starting your own relationship. Then you come to me and you're telling me your partner is AS. Then it doesn't make sense because you want to continue that in your family. So I want you to focus on the mathematics. What you have is what you give. So if you have two S's, that's what you're going to contribute. So if your partner has any S at all, then there's a problem. But if you have two S's and your partner is AA, your partner will dilute your S. The same thing, if you have two C's, your partner will dilute your C's. If you have SC, your partner will dilute that. So the people that will dilute this in our community are the people that have AA. Just like the attendants. Their partners are AA, but they are AS and AC. So we need to know about this. If we can begin to teach our kids, if we can begin early to teach them this, because they're going to find people they love, don't be afraid to start a conversation. Open up and ask. And don't just ask, because anybody can tell you anything and they can pretend to love you until things start going wrong. So if you're dating any man or any woman and he tells you he's AS or AC, carefully go to a good lab and confirm. There is nothing wrong in confirming. There is nothing wrong in talking about the future of your family. So if your male partner tells you, oh, honey, I love you so much, and AA, accept that love with one leg, then go to a very good lab so they can confirm. Once you guys are confirmed to be compatible, say go back. Okay? So that's my conversation this evening. Pretty much straightforward, direct. Be careful when you go out there contracting relationships. Remember, once you have a sexual relationship, you can become pregnant. Once you become pregnant, no other option in our organization. We are pro-babies. We are pro-mothers. We are pro-life. So be very careful before getting there. If you don't want to get pregnant, then there are so many methods of contraceptives you can use to avoid pregnancy. But once pregnancy happens, we love our babies. We love our mothers by any means possible. Okay? So I'm going to allow you to ask me questions in the next few minutes so we can end the clinic. So please go ahead and ask your questions. Ask your questions. The clinic is open. Okay? All right. Do you have questions? If you have questions, okay. What advice should you give to a friend whose husband is AS and she's AS too? You have been listening to me. What else do you want me to tell you, my sister? Both of them are not compatible. It's a hard place to be. Now, if they've already married, right? Both of them are already in relationship. So you mentioned hobby. So they're already in it. So many people there are so many places that they don't even have facilities to check newborns to see what their genotype is. So it's not something that is out there that people can check easily. So if you are already in relationship, then you discover that both of you are AS. This is what I will tell you. If you have not started your family, I want you to make appointments and consult a fertility specialist. We can conduct a special IVF and we can carefully select only babies that won't have the sickle cell disease through the process of PGD, pre-genetic diagnosis, or PGT, pre-genetic testing. So there is something we can do. Unfortunately, it's expensive. So if you happen to find yourself in a relationship already, especially married relationship, and you're AS and your partner is AS, please don't play poker with your family. Because per any pregnancy, you have 25% chance. So I've actually seen some very not so comfortable outing in some families. So these two couples, they are AS. Like I told you, you can have 25% chance of avoiding it completely. There are some families that can avoid sickle cell trait. So both of them can be AS and they can have 4 kids, and those 4 kids can be AA. But on the contrary, if you have two S's in the family, you can have 4 kids and 4 of them can be sickle cell kids. So we can't gamble with this. Because once you have 2 S's, possibility they will join together is high, 25%. So there is no pattern. So there is no like, oh, the first one will be S, the second one will be A. No, it just is random, 25% chance. So if you are already in, then think about genetic counseling. That's the only thing I will advise you. But please, by any means possible, let's not be selfish. What I've noticed in life, sometimes as adults, we are selfish. Most of our decisions is for ourselves. We don't think about our kids. Even some families that have kids weaponize the kids. We only think about, oh, this person did this, I'm going to work out. We don't think about our kids. But you can begin to think about your kids even before they are born by making critical decisions about their future. So don't be selfish. So when you begin to tell me about Romeo and Juliet without knowing your standard, then that's selfishness. So don't tell me, oh, I love him so much. Oh, she loves me so much. I can't do without him. That's a lie. There is someone out there that will still love you the right way. We have to protect our future. We have to protect our family, okay? Guys, keep asking your questions. Ask your questions, please. If you still have questions, go ahead and ask. I'll provide you feedbacks. If you have not confirmed the veracity of your own genotype, please book an appointment, go to a good lab, and make sure it's confirmed. Don't allow what happened to me to happen to you. Very important. So imagine if my wife also thought she's whatever she's not, and we ended up being SS, and they checked and Zara is SS. Think about that. Our babies deserve to have peace. Our world is already a very, very worrisome, troublesome place. So if we are bringing babies into this world, we should make their world as comfortable as possible. You see, you guys see me in America, right? Growing up, I didn't have all the liberties that my kids have. I practically, grew from the grass up. But my kids, they have every single thing I never had. This is your prayer for your kids. Your kids should have everything you never had. Their world should be a better place. So when you're going into that relationship, think about the kind of kids you're going to bring into this world. Difference between trait and the disease. Very, very important question. So I'm going to use 2 examples. So I want you to focus on SS and AS or AC. So someone that has 2 S's, that's 2 abnormal hemoglobin. SS, that's homogeneous, concept. Now, when you have trait, it means you are a carrier. You don't have sickle cell disease, but you carry it. You can transfer it to someone else. So I'm a carrier of abnormal C hemoglobin because I'm AC, but my wife is AA. If someone else has SS, that person has the disease. So the disease is applicable when you have double S or double C or SC. But when you have AS or AC, you are called a carrier or a trait. That means you carry it. Now, for some reasons, medically and scientifically, people that have AC or AS are protected from severe form of malaria in the community. We don't know why. So that's the difference. So for the disease, you have 2 abnormal genes, but for the trait, you have 1. You're a carrier. Okay? I love that question. Very smart and intelligent question. Okay, guys, go ahead and ask me questions. I know it's not your everyday multiple pregnancy, high topic and stuff, but this is very important. If today is the first day of attending my clinic, this is who I am. I show up every Tuesday, then Saturdays, and we educate our community. Before you leave today, make sure you hit that subscription button. Now, we have some exclusive community. So if you desire to interface with me and have access to me privately, and we can discuss your case and all that, we have a special community. When you click on the front page, you click on join, then you decide how you want to meet me halfway. For the people that have already joined, thank you so much for joining. There are so many benefits of being a member of the exclusive community. So many perks, so many things you can easily glean from me. So decide today to use the knowledge, because knowledge is power. The more you are equipped with the right knowledge, the more you can protect yourself and protect your family. Okay? All right. Is it true that sickle cell people are not affected? It's not true. They might have not sickle cell people that have the trait. So if you have AS, when you contract malaria, you will have the less severe form of malaria compared to someone that have AA. So people that have AA might have the severe form of Plasmodium falciparum, which is the malaria parasite. But for some reason, the sickle cell disease, the sickle cell trait confers a kind of protection. For some reason, we don't know why. So it's not true. It doesn't mean you can't suffer malaria. Anybody that gets bitten by a female Anopheles mosquito will definitely suffer malaria, but it depends on the severity. Okay? So it's important we understand the difference. Okay? You have to understand the difference between having malaria, having mild malaria, severe malaria, or moderate malaria. We are worried about the severity. Okay? All right. Do you still have any questions? Please ask your questions before I go. I have about 4 more minutes. Ask your questions in real time. Tomorrow, in my community health clinic, we're going to look at heart failure. So what's heart failure? And what can we do to prevent heart failure? You see all those people that will come and say, oh, someone went to the village and they gave the person jars and the person suddenly died. It might be heart failure. Now, thankfully, when someone has heart failure, it doesn't mean that the heart has completely stopped. It means there are a couple of things happening in the heart, so we need to be careful. So join me tomorrow for that community health clinic. Don't miss it for anything. During my lunchtime, 12 p.m. Eastern Time, US, 5 p.m. Nigeria, come invite someone, maybe your relative, maybe your mother, maybe your father had heart failure in the past. They survived. Please come. Let's learn about things we need to know and things we need to be on the lookout to avoid having heart failure. If your parent or your sibling or your relative already had heart failure, also show up so we can tell you how you can continue to be in health. Very important class. You don't want to miss that class tomorrow. Okay? All right. Thank you so much, guys. We have 3 more minutes. In the absence of any other question, I'm going to take my leave. But thank you for coming. Remember that on Sunday, we have a very huge event. If you miss this, you've missed a lot. Advanced maternal age super masterclass. You see, as a woman is aging, when she gets to age 35, there are several changes in her body, which over time will affect her ability to start her family. 35 is a very critical age in the life of a woman. So once you get to that 35, you are classified as what? Advanced in maternal age. So there are a couple of things you need to be conversant with. We're going to have subject matter specialists on the 29th, 9 p.m., exclusive class. We have a special group where we're going to host this class. You don't want to miss this class. So make sure you register. You still have a few more days to register, and I'll meet you guys halfway. Okay? Thank you for joining. My COO, if you have any question, please shoot me your question before I go. Yeah, thank you, Ada Vivian. Do you have any question? If you have any question about the topic, remember we're talking about preventing sickle cell disease by knowing our genotype so we can prevent that, okay? You've heard that for the first 6 months after birth, a sickle cell baby has some protection from crisis. That's not true. You see, there are predisposing factors, okay, that will lead to crisis. So crisis simply means when a greater percentage of the hemoglobin, which is supposed to carry oxygen, is in the body of the baby, they will block the vessels. So oxygen will not get to the places it's meant to get, and the baby will begin to have what we call vaso-occlusive crisis. Very painful condition. So anywhere there is blockage of oxygen in the body, that particular organ can fail. Okay? Now, the probability of having crisis, it's when you are exposed to the risk factors that can lead to crisis. So there are some people that are already sickle cell disease clients, and they know what they can do to precipitate having crisis. So the key word is to avoid those things. So it's not true that within the first 6 months, such situation will happen. What we know for sure is the fact that when kids are born, they will have a lot of challenge in regards to maturation of the organs that handle a lot of blood cells in the body. So most babies that are born new might have what we call physiologic jaundice because the body is already overwhelmed by the number of red blood cells they need to break down. Normally, when you break red blood cells down, it goes to the liver and it's removed from your body. But a newborn doesn't have fully formed liver, so most times they get overwhelmed and they develop jaundice. Okay, but it's not true that, within that 6 months, they have a kind of protection. Okay? Is there any treatment for sickle cell anemia? Right now is only management, but, they've had a couple of, researches and new therapies, but they are not widely available. And some kids can also go for bone marrow transplant, but it's not widely available. It's still at the experimental phase. But I think a few years ago, they mentioned something about getting a drug and all that. But let's forget about getting to that stage. Let's prevent it from happening. Anything you can prevent in life, prevent it. Because prevention is always better than cure. Correct. Sickle cell, it's actually found more in people of African origin. So yes. Sickle cell, remember? The sickle cell disease itself is having two essays. When you have just one, you have the trait or you're a carrier. So for some reasons, people of African origin tend to have more prevalence, more cases of sickle cell disease for some reasons. It's all over the race, but African origin race have a greater percentage of people that have sickle cell disease. So the answer is yes. Okay. All right. Thank you for coming. My time is up. And I'll see you guys again on Saturday. Now, Sunday, we won't have any clinic because Sunday is going to be our super master class. So if you haven't registered, once again, an opportunity to register. Remember, if every other thing fails, God will never fail you. So keep on keeping on, keep on believing, keep on practicing your PPP. So many women are not practicing PPP. So many women say, I'm tired, I'm busy, I'm that. Look, prioritize. Prioritize. What you prioritize will manifest. Keep on seeing your future babies. Keep on bringing them into limelight and know your opportunities, know your chances. Unfortunately, there are some women that might be having recurrent miscarriages, and for some reason, their body might not be able to carry baby to term. Think surrogacy. Think about other options. You deserve to be happy. You didn't come into this world to just suffer and go. No. Cut some slack for yourself. So know what's happening to your situation, know the best option for you at that particular time, then go for it. Make sure you and your partner are on the same page. Okay? I'll see you guys again on Saturday. Until I see you, thank you for coming and have a good evening. Bye-bye for now.